This is a 12-year-old young man from Seattle who presents himself for treatment. We're starting his treatment today by delivering an appliance. And you just look into the camera. He's got 35 different tics, from eye blinking, shoulder shrugs, head jerks, brushing or tossing hair, mouth opening, facial grimace, nose twitching, and so on. He's filled out a whole list of tics: throat clearing, grunting, sniffing, snorting, speaking, stuttering sometimes, twirling around, hopping, thrusting movements, etc. And you can see as he's going through some of these tics, and I haven't mentioned them all, that we want to eliminate them. He's 12 years old and he's in school, right? Mm-hmm. Yeah. And you're not aware of girls yet, are you?
No.
You will be.
Yeah.
Okay, if I fix your tics and you get too many girlfriends, I get your overflow, okay? That means the extra ones you send to me.
Okay.
Okay. Okay, look, you want to say something to the viewing audience? Anything at all?
No.
You just hope this works, huh?
Yeah.
And hopes it works darn quickly, huh?
Mm-hmm.
Okay. Well, I'm going to promise you it does, because we can help you out very quickly. And we're going to finish polishing up your appliance right now, which is in its final stages of fabrication. And then we're going to see it tomorrow. And we're going to film you tomorrow and the next day to show the improvement already. Okay? We are putting this appliance in now, really for the first time, on this young man. Okay, bite. Like that. And you can notice that it has an immediate effect on his tics. It just brings him to a screeching halt if you've chosen the right position and positioned it correctly. Okay, now we're going to see this boy tomorrow. What time's your appointment?
9:45.
Okay. 9:45 will be about 16 or 17 hours from now, and we'll see the effect in 16 or 17 hours. Does that hurt you in any way or cause any problems, any strain? You think you'll be able to eat with it, sleep with it, talk with it?
Yeah.
If it makes you talk funny, which it probably does not, but if it does, you can practice reading out loud.
Okay.
Get yourself a newspaper or something and read it out loud. Okay. It is now 10 o'clock the following morning after the delivery appointment, and we have, the patient has been wearing this appliance for approximately 16 hours or so. And you can see that his tics are mostly gone. Tell the viewing audience what your experience has been.
It was good. I got really good sleep last night.
Speak louder, speak.
I got good sleep last night, and I haven't ticked at all, really. So.
Okay, that's pretty good for less than one day. Do you want to say something? Come on back here. Okay, this is this boy's mother, and she's going to comment on the improvement in the past 24 hours, or the past 16 hours.
Well, the first thing that I noticed was the calmness. There wasn't the ADHD symptoms. He seemed very focused, and obviously the tics weren't happening, which is like a miracle for us. He was almost like a different personality. He was very focused is a good way to say it, and calm. I've never seen him so calm. And he slept so good last night. The hotel we're staying at, there's 2 queen beds. I didn't hear him ticking all night. I couldn't get him up this morning. It was like trying to get a sloth out of bed, which is not normal for him. He's usually bouncing off the walls. So it was really a miraculous turnaround in his life. I think it's going to change his life forever. So, yeah.
Well, that's excellent. That's a good endorsement. Good. You're doing all right. We're going to have to send you out to Hollywood. Huh? Okay, girls will be throwing themselves in front of your bicycle soon before you go back home. Okay, so this boy returns for his first checkup. He's been wearing it 40 hours now, And you can see from his lack of movement that he's responding well to his treatment. His tics had returned a little bit, and we've made an adjustment this morning for him. Did you want to say something?
Not really.
Okay. How about you? You ready to say something? Do you want to say anything?
Okay, yeah.
Okay.
Yeah, it's definitely working. I can see already with the adjustment that he's returning to no tics and no ADHD symptoms again, so that's good.
This young man returns. He's been wearing his appliance 6 days now. And as you can see, his tics are totally gone. You want to say something for the viewing audience?
It's helped a lot.
It helped a lot. Speak louder. Speak louder.
It helped a lot, and I don't tick anymore. So
Okay. Think you'll get a girlfriend now? Remember our deal. If you get more girls than you can handle, I get your overflow. Okay? That's the deal I make with all these young guys. It hasn't paid off for me yet at all. Come on back. Come on up here. Why don't you say something?
This has just been a life-changing thing for Dane, and we're just so happy that we came and saw Dr. Stack. It was worth the trek from Seattle. And it's just been amazing to see, like, almost zero tics. You know, he's just like a different child, and it's even lessened the ADHD symptoms, and he just seems calmer and more focused and able to just, I don't know, it's hard to explain, but he just seems really happy, and it's a lot better. It's changing his life. I can see where it'll help him in school too.
He's sleeping better?
Sleeping better. Oh yeah, it's hard to even get him out of bed in the morning. We were almost late for his appointment today.
Where before he wasn't a good sleeper at all, was he?
No.
And you feel he's had personality changes that are beneficial?
Absolutely, yeah. It's totally different. It's a different child.
He's nicer to have around now?
Yeah,
Okay.
he is. Not that he was terrible before, but he was feeling miserable before, and now this has calmed him down. You know, just feels more grounded, I think is a good word.
Okay.
Yeah.
Yeah, and focus too.
Yeah, definitely his help is focus.
Okay.
So.
Well, you go back to Seattle and tear him up there, okay?
Yeah. We haven't seen. He hasn't had any seizures either. So.
Oh, he was having what kind of seizures? Petit mal seizures? Epileptic seizures?
Myoclonic?
Myoclonic seizures?
No myoclonic seizures.
At all in the past 6 days. Huh? And how frequently had he been experiencing those?
Probably all day long, every hour or so, or just little, you know.
Okay, well that's a benefit right there in and of itself. He's seizure free now. Great.
Yeah. So thank you, Dr. Stack.
You're more than welcome.
Yeah.
Get on home, kid.
Yeah.